So the 18th question is, what is the most common cause of the perforation of the esophagus? A is barotrauma, second is mediastinitis, third is iatrogenic infection, and fourth is the malignancy. So if we look at what is the most common cause of perforation of the esophagus, it is iatrogenic. It is instrumental perforation. It is instrumental perforation. So we have two sources here. One is the Bailey's. So this is from the Bailey. So the Bailey writes that instrumentation is by far the most common cause of perforation. So the most common cause of perforation of esophagus is instrumentation. If we see our second reference, it is from the Swartz, which writes that the perforation of the esophagus constitutes a true emergency. It is most commonly occur following diagnostic or therapeutic procedures. Then other causes are spontaneous perforation, which is referred to as the Boerhaave syndrome, account for only 15% of the cases of esophageal perforation, foreign bodies for 14%, and trauma for the 10%. So we can say that the most common cause of the perforation of esophagus is instrumental or endoscopy or your iatrogenic. But in this option, the examiner has played with the language. In the C option, they have written iatrogenic infection, not just iatrogenic. So that's why the C option is wrong. That's why iatrogenic infection is not the answer. Then we have the barotrauma, which is known as the Boerhaave syndrome. Boerhaave syndrome or spontaneous esophageal rupture. Esophageal rupture. So it constitutes about 15%. Then we have mediastinitis. Mediastinitis is not the cause. Is not the cause. Is not the cause. Rather, it is a complication. It's a complication of esophageal rupture. It's a complication. So that's why mediastinitis is wrong. Then we have the malignancy. Malignancy is very rare and does not causes esophageal perforation. So it is not one of the most common causes. We have seen that in the Swartz it is written that it is first the diagnostic or therapeutic procedures, then Boerhaave 15%, then foreign body 14%, then trauma for 10%. They have not even mentioned the malignancy. So it's even if the perforation will be occurring because of malignancy, it is very rare. So malignancy is wrong. So in this option, the answer is A, barotrauma, and the answer key also writes the same. So even the answer key which was provided by the UPSC provides the answer to be A or the barotrauma. So we have to understand it that if sometimes for the next time if the question comes and the option is the C, iatrogenic only, not infection, then we have to mark iatrogenic C as the answer. But because they have played with the language and they've written iatrogenic infection, that's why barotrauma will be the answer. Now, seeing the barotrauma about it or the Boerhaave syndrome, we have to know that what is it? It is spontaneous transmural, means all the valves are involved, all the layers are involved. Spontaneous transmural esophageal rupture, after vomiting. It has a classical triad of vomiting, then chest pain, and then subcutaneous emphysema. And it usually occurs in lower 1/3 of esophagus or left, and in the left posterior lateral wall. So the answer in this case will be the barotrauma.